This is standing vibrating traction. And what's unique with this traction is this traction is actually performed on a vibrating plate. And this vibration plate actually vibrates around 30 hertz. And the vibration helps amplify anything that we do on the traction. Now, generally, this traction is just used for elongation. And what we're doing is we just elongate up while the machine is vibrating to help increase the flexibility and stretch out the spine. However, with scoliosis patients, there could be very specific setups to help increase the effectiveness of the traction to help localize the traction in a specific force if we're trying to deal with a scoliosis pattern. So let's show you some different setups that we do for scoliosis patients specifically. This is one of the variations for standing vibrating traction, and this is where we added something called an anterior chest weight. And this anterior chest weight applies some force on the lower cervical spine and localizes the traction in this area. So the chest weight carries a counterforce where the traction's pulling up. This can help decrease upper thoracic kyphosis, sometimes we see in scoliosis patients. So this is one of the unique setups that we use for scoliosis. This is another variation of standing vibrating traction, and this is done for a lumbar curve. And this is where we use a counter weight on the lumbar spine to help focus the force here in the lumbar curve. So as we pull up with the traction, the counterweight is causing a tilt and pulling down, and it helps focus the traction into this area. And this can be effective with the vibration and help elongating the spine, especially in the lumbar curve. This is another variation of standing vibrating traction. This one is done specifically for a thoracic curve. And the reason why we do this is that we're trying to correct this upper thoracic curve, or call it a proximal thoracic curve. Many thoracic curves will start in the cervical spine and extend down. And this curve right here is very hard to push on in any kind of lateral motion. So what we're doing is that we're pulling up with the vibrating traction, and then we're using this weight for it to pull down on this shoulder to help open up this curve. And the patient's instructed just to relax this shoulder and let the traction kind of elongate this area. When you add the vibration and this traction, it can have a great effect in this area because it localizes the traction.